Vitamin D plays a vital role in maintaining the health of your body and brain. When you are deficient in vitamin D, it can have widespread effects, as this nutrient is crucial for calcium regulation, immune function, and cellular processes. Here's what happens to your body and brain during vitamin D deficiency. Effects on the body: weak bones and teeth. Calcium malabsorption. Vitamin D is essential for absorbing calcium from the diet. Without enough vitamin D, calcium levels drop, leading to osteomalacia in adults, soft, weak bones that are prone to fractures. Rickets in children, bone deformities like bowed legs. Tooth decay. Poor calcium absorption can weaken tooth enamel and cause cavities. Muscle weakness and cramps. Muscle tissues rely on vitamin D for proper function. Deficiency can cause muscle weakness, leading to difficulty with physical tasks. Muscle cramps or twitching due to impaired calcium regulation. Immune system impairment. Vitamin D supports the immune system. Low levels increase vulnerability to frequent infections, such as colds, flu, and respiratory tract infections. Chronic inflammation, which can contribute to autoimmune diseases like rheumatoid arthritis or multiple sclerosis. Poor wound healing. Vitamin D helps regulate inflammation and promote new cell growth, both of which are critical for wound healing. A deficiency may delay recovery from injuries or surgeries. Cardiovascular issues. Insufficient vitamin D can disrupt blood pressure regulation, increasing the risk of hypertension. This leads to cardiovascular diseases, such as atherosclerosis or heart failure, by promoting inflammation in blood vessels. Increased risk of chronic diseases. Prolonged deficiency is associated with higher risks of type 2 diabetes. Vitamin D is involved in insulin production and glucose regulation. Certain cancers, low levels may impair cellular health and increase susceptibility to cancers like colon, breast, and prostate cancer. Effects on the brain. Mood disorders, depression and anxiety. Serotonin regulation. Vitamin D influences serotonin, a neurotransmitter that affects mood. Deficiency can lead to depression. Low serotonin levels may contribute to feelings of sadness, hopelessness, or fatigue. Seasonal affective disorder, SAD. Vitamin D deficiency is common in winter months, exacerbating mood disorders. Cognitive decline. Vitamin D supports brain health by reducing inflammation and promoting the health of neurons. Deficiency may cause memory problems or forgetfulness. Difficulty concentrating, often referred to as brain fog. An increased risk of dementia or Alzheimer's disease in older adults. Fatigue and lack of energy. Low vitamin D levels can disrupt mitochondrial function, leading to decreased energy production in brain and body cells. This results in chronic fatigue and reduced productivity. Increased risk of neurological disorders. Prolonged vitamin D deficiency has been linked to conditions such as multiple sclerosis, MS. Vitamin D plays a role in regulating the immune system, which may protect against autoimmune attacks on the nervous system. Parkinson's disease. Some studies suggest a link between low vitamin D levels and the progression of neurodegenerative diseases. Other symptoms you might experience: hair loss. Severe deficiency can contribute to hair thinning or alopecia. Weight gain. Vitamin D may affect metabolism, and deficiency has been linked to increased fat storage. Sleep problems. Vitamin D influences melatonin production, essential for regulating sleep-wake cycles. Who is most at risk for vitamin D deficiency? People with limited sun exposure, for example, those living in northern latitudes or wearing full body coverings. Individuals with darker skin. Melanin reduces vitamin D synthesis. Older adults, reduced ability to synthesize vitamin D in the skin. People with digestive disorders affecting fat absorption, like celiac or Crohn's disease. Those who are overweight or obese, vitamin D can get trapped in fat tissues. Vitamin D deficiency does not directly impair vision in the way that vitamin A deficiency does, which can cause night blindness or more severe eye problems. However, it can have indirect effects on eye health and vision through its role in various bodily functions. Here's how vitamin D deficiency might impact your vision or eye health. Increased risk of age-related macular degeneration. AMD connection. Vitamin D has anti-inflammatory properties and helps protect against oxidative stress, both of which play a role in age-related macular degeneration. Effect. Low vitamin D levels may increase the risk of AMD, a leading cause of vision loss in older adults. Dry eyes connection. Vitamin D supports the health of tear glands and helps reduce inflammation in the eyes. Effect. Deficiency has been linked to dry eye syndrome, which causes discomfort, blurry vision, and a gritty sensation in the eyes. Increased risk of diabetic retinopathy. Vitamin D helps regulate blood sugar and reduce inflammation, both of which are critical for individuals with diabetes. Myopia, nearsightedness. Some studies suggest that adequate vitamin D levels, likely linked to outdoor activity and sunlight exposure, may play a protective role in preventing myopia. Vitamin D deficiency might contribute to the progression of myopia, although the exact relationship remains under investigation. Optic nerve health. Vitamin D supports nerve health and reduces inflammation. Conditions like optic neuritis, inflammation of the optic nerve, may be more common in individuals with vitamin D deficiency, especially in autoimmune diseases like multiple sclerosis, MS. If the optic nerve is affected, it can lead to vision problems, such as blurred or diminished vision. Chronic vitamin D deficiency may contribute to oxidative stress and inflammation in the lens of the eye. Some research suggests a potential link between low vitamin D levels and an increased risk of cataracts, although more studies are needed. While vitamin D deficiency is not a primary cause of vision problems, it can indirectly affect eye health by increasing the risk of conditions like macular degeneration, dry eyes, and diabetic retinopathy. Maintaining adequate vitamin D levels is essential for overall health, including supporting the protective mechanisms that preserve vision. Vitamin D deficiency affects nearly every system in the body. Physically, it weakens bones, muscles, and the immune system, while mentally, it impacts mood, cognitive function, and energy levels. Recognizing and addressing deficiency early through sunlight exposure, diet, or supplementation can significantly improve overall health and well-being. If you suspect a deficiency, consult a healthcare provider for appropriate testing and treatment.